Hey, welcome back to Good Morning Vail. For a lot of you, you might be in town and maybe you're just having a few aches and pains. Well, lucky for you, we have Vail Integrative Medical Group here in the Vail Valley. And joining me this morning, we have Dr. Mark Pitcher. And Dr. Mark, you happen to have, well, there's a lot of letters and a lot of accolades that go along with your name and your studies. But something that you do really, really well is work with a lot of professional athletes.
Yes.
And can you tell us just a little bit about what it is that you do with Vail Integrated Medical Group and how it is that you help some of these professional athletes?
Certainly. Well, I'm a sports chiropractor, and we have a number of sports chiropractors in our practice. So we treat a lot of athletes from high school to college, Olympic dancers, lots of different types of athletes, and they have a lot of certainly a lot of different types of injuries. From your knee problems, shoulder problems, ankle problems, all that stuff. But we also treat a wide segment of the population beyond just athletes. And probably low back pain would be the leading problem that we see with that.
Right. Okay. So lower back pain. So it's obviously it's not just something that affects athletes, but it is something that can affect maybe some people that are just joining us just for a vacation, just for a short time. And so, what are some of the myths that you find about lower back pain?
Well, probably the biggest one is that people think that low back pain is normal.
Right.
And there's a difference between normal and common. Back pain's common, but you shouldn't have it. It shouldn't be there. So that's sort of the first one. One of the problems with treating low back pain in general is a lot of the misconceptions that are out there. A lot of misinformation, and those myths, if they're perpetuated, then it interferes with their recovery. So you sort of have to address some of these myths with patients. Another myth would be that stretching and foam rolling is going to fix your low back pain.
Right.
And frankly, if you've been doing it and it hasn't worked already, it's probably not going to. And in fact, stretching for lots of different types of low back pain is going to aggravate things. If you have a disc problem, stretching your hamstrings is just going to aggravate it. Doing toe touches, crunches, those kinds of things, certainly not great for your low back. So there's that's certainly another thing.
Right. Interesting. And so, what are some of the the ways that you actually treat lower back pain?
Well, there's lots of different options. That's another myth. It's like, hey, it worked for my friend, maybe it'll work for me for this particular type of treatment XYZ. But the reality is there's lots of different types of low back pain, lots of reasons for it. Low back pain isn't a symptom, or it's a symptom, not a diagnosis. And frankly, non-specific low back pain, lumbar sprain, strain, they're not good diagnoses. They're just that just won't do. You need to get to the root of the problem, figure out the underlying pain generators, the things that is causing the problem, and then you can pick out your treatment options. With us, we have sort of everything under the sun, sort of conservative, non-surgical treatment options. So everything from chiropractic to physical therapy to dry needling. We have massage therapy, so corrective kind of exercises. Lots of different things, but the crux of the problem is you have to get to the root.
And so if people want to do that, which I'm sure a lot of you do because lower back pain is not fun,
no.
How would they go about making an appointment with you and really kind of starting to discover what might be really going on?
Well, you just call the office.
Just call the office.
Call the
All right,
office.
nice and simple.
Visit
Okay.
the website. You can. I don't think you can book online, but you can certainly get all our contact information there. And either book with one of our chiropractors, one of our physical therapists. Figuring problems out is what we're really good at. So we're a 10-minute evaluation. Isn't going to cut it. You have to sit down, talk to the patient, get their history, listen to them, and do a thorough evaluation. With that, you can figure out what the problem is and then move forward. So we're certainly happy to take care of people with that.
Well, we love that you're here and that you can do that for us. And again, if you want to give them a call and start your journey to finding out what's going on, 970-926-4600 or vailhealth.com. Thank you so much for coming in this morning.
I think it's good to be here.
Yeah, definitely. I think a lot of people definitely need to hear that information. So again, vailhealth.com to find out more information or just to see some of the testimonials of people that have really found the right solution with this incredible group of people that we have in the Valley. Coming up next, we have a look at what's going on with your weather out there, so stay with us.